Hi, my name is Cooper Kidd, and I use they/them pronouns. Today, we will be discussing HIV and the LGBTQ+ community. What is HIV? HIV, otherwise known as human immunodeficiency virus, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. How is HIV spread? HIV is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. What happens if you have HIV? If left untreated, HIV can lead to the diagnosis AIDS. The human body cannot get rid of HIV, and no effective HIV cure exists, so once you have HIV, you have it for life. However, if someone is undetectable, meaning that their viral load is under a certain number, they are not capable of transmitting the virus. Undetectable equals untransmittable. U equals U. So if a person who has HIV does an awesome job taking their meds every day, the likelihood of passing HIV is almost impossible. However, by taking HIV medication, also called antiretroviral therapy or ART, people with HIV can lead long, healthy lives and prevent transmitting HIV to their sexual partners. In addition, there are effective methods of preventing getting HIV through sex or drug use, including pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. So what is AIDS? AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. In the US, most people with HIV do not develop AIDS because taking HIV medication every day as prescribed stops the progression of the disease. It is important to note that there is a problem in our society that many people use the terms HIV and AIDS as if they are interchangeable, but that couldn't be more wrong. HIV is a virus that can lead to a diagnosis of AIDS. How does HIV affect the LGBTQ+ community? HIV disproportionately impacts segments of the LGBTQ+ community. According to the U.S. Centers for Disease Control and Prevention, CDC, there are 1.2 million people living with HIV in the United States, and approximately 40,000 people were diagnosed with HIV in 2015 alone. While the annual number of new diagnoses fell by 19% between 2005 and 2014, progress has been uneven. For example, gay and bisexual men made up an estimated 2% of the U.S. population in 2013, but 55% of all people living with HIV in the United States. If current diagnosis rates continue, 1 in 6 gay and bisexual men will be diagnosed with HIV in their lifetime. For Latinx and Black men who have sex with men, these numbers are even more jarring. And for transgender people, they have also been hit particularly hard by the HIV epidemic. While better data is needed to understand the full impact of HIV on the transgender community, one international analysis found that transgender women in certain communities have 49 times the odds of living with HIV than the general population. What makes LGBTQ+ people particularly vulnerable to HIV? Discrimination against LGBTQ+ people makes them particularly vulnerable to HIV. In most states, it is perfectly legal to discriminate against someone on the basis of their sexual orientation or their gender identity in one or more aspects of their lives, including employment, housing, and public accommodations. And dealing with the potential consequences of bias and discrimination, job loss, homelessness, lack of healthcare insurance often results in LGBTQ+ people engaging in behaviors that will facilitate the spread of HIV. For example, in the face of persistent employment discrimination, many transgender women are left with few other options but to engage in survival sex work to meet their most basic needs. Anti-LGBTQ+ bias further enables the spread of HIV by discouraging many in the LGBTQ+ community from getting tested or treated for HIV for fear of harassment as well. It is also important to note that HIV prevention, treatment, and research programs are underfunded. Following decades of inadequate funding, our nation's public health infrastructure lacks the resources it needs to aggressively respond to the HIV and AIDS epidemic. This arrangement has been devastating for members of the LGBTQ+ community since the little funding that does exist for HIV prevention, treatment, and care has not been focused on or funded in the communities most impacted by HIV. What advancements have been made? There have been many advancements in HIV prevention, treatment, and care. HIV tests are faster and more reliable than ever. HIV medications are safer and more effective, and there are now several ways to prevent the spread of HIV, including condoms and PrEP. PrEP is an HIV prevention strategy that currently involves taking a once-a-day pill called Truvada. When taken as prescribed, PrEP is highly safe and effective at preventing people from becoming HIV positive. How do I get tested for HIV? There are many HIV testing centers in many communities across the United States. All you have to do is Google HIV testing centers and your zip code. We have now reached the end of this video, and I want to thank you for taking the time to learn more about HIV. I hope that you were able to learn a lot, and hope that you have a great day. Goodbye!